Imagine like buying a product that is explicitly marketed to hydrate your body, right? Only to find out it is formulated with chemistry that actively sucks the moisture out of your cells at a microscopic level.
Oh, yeah. I mean, it happens every single day in the pharmacy aisle,
It's crazy.
right? Because people dealing with already compromised tissue are inadvertently buying these products that cause cellular dehydration, swelling, and further damage. And it's entirely because of the invisible chemistry in the formula.
Welcome to the deep dive. Today, we are looking at a diagnostic and treatment landscape that is, well, it's full of incredibly common but rarely analyzed physical challenges.
Yeah, highly stigmatized too.
Exactly. We are targeting the overwhelming and honestly pretty confusing world of natural and over-the-counter treatments for vaginal dryness and atrophy. Because, when estrogen levels drop, whether that's from menopause, perimenopause, cancer treatments, or even postpartum shifts, the resulting physiological changes, which are collectively known as genitourinary syndrome of menopause or GSM, they really alter the very structure of the vaginal tissue.
Right, and the structural shift is profound. I mean, estrogen normally drives glycogen production in the vaginal epithelium.
Okay.
And that glycogen, it feeds the local microbiome, specifically the lactobacilli,
Yeah.
which in turn produce lactic acid to keep the whole environment healthy. So when estrogen drops, that entire chain just collapses.
Wow, so the whole ecosystem just shuts down.
Yeah, the tissue loses its natural plumpness, blood flow decreases significantly, and the environment just becomes incredibly fragile.
Now, prescription estrogen, like low-dose vaginal creams or rings, is widely considered a gold standard for treating this, right? Because you're replacing the hormone exactly where it's needed.
Exactly, yeah.
But the sources we are diving into today acknowledge that a lot of you listening either can't use hormones, maybe due to like estrogen receptor positive breast cancer, or you simply just prefer non-hormonal routes.
Right, and that is a huge portion of the population.
It really is. So the goal for this deep dive is to basically extract the exact science-backed facts from clinical guidelines and pelvic floor therapy resources. We want to determine which natural or over-the-counter moisturizers and lubricants actually work for vaginal atrophy and, which ones are secretly making the problem worse.
And to build that effective science-backed toolkit, we really have to start by completely separating two categories of products that are frequently and honestly disastrously confused.
Okay, what's...
Moisturizers and lubricants.
See, that is interesting because if I'm dealing with chronic dryness, my first instinct is to just grab whatever says lube right before intimacy. I mean, that solves the friction problem, so doesn't that inherently solve the atrophy problem too?
No, not at all. It is a fundamental mismatch of purpose.
Really?
Yeah, a lubricant is designed purely for short-term friction reduction, during sexual activity or maybe a pelvic examination. It just sits right on the surface of the tissue, provides temporary slickness, and has a very short duration of action. Once the activity is over, its job is done.
Oh, I see.
So relying on that to treat chronic GSM is essentially, well, it's like putting a wet Band-Aid on severely dehydrated skin and expecting the underlying cellular structure to heal.
Okay, so it's like treating a chronically damaged skin barrier by just splashing water on your face right before you smile so the skin doesn't crack.
Yes, exactly. You haven't actually changed the health of the tissue at all.
Wow. Okay, so what does a moisturizer do differently then?
Well, a vaginal moisturizer, on the other hand, is formulated for long-term tissue hydration and repair. Like it's designed to actually be absorbed into the vaginal walls.
Got it.
It affects the fluid content of the epithelium, helps lower the vaginal pH back to a healthy acidic level, and physically plumps those cells up. In fact, the clinical guidelines recommend using a moisturizer 2 to 3 times a week.
Oh, so completely regardless of sexual activity.
Completely regardless. It's just to maintain baseline tissue health.
Okay, so moisturizers are the daily maintenance routine, and lubricants are the situational add-on. That makes a lot of sense. So if we look at the moisturizers first, I noticed the clinical literature heavily features 2 specific chemical compounds.
Yes, hyaluronic acid and polycarbophyll.
Right. And I know hyaluronic acid from, like, expensive topical face serums. Does that cosmetic logic actually translate internally to mucosal tissue?
It translates perfectly, actually, because the biological principle is identical.
Really?
Yeah. I mean, hyaluronic acid, or HA, is a glycosaminoglycan.
That's a mouthful.
It is, yeah.
Yeah.
But it's just a naturally occurring long-chain sugar molecule in the human body. And its primary function is structural hydration. So a single HA molecule can hold up to, like, 1,000 times its own weight in water.
Wait, 1,000 times?
1,000 times, yeah. And in a healthy estrogen-rich environment, the body naturally produces plenty of HA right in the vaginal tissue to keep it elastic and thick.
Oh, I see where this is going. So when the estrogen drops, the natural HA production just drops right along with it. So applying an HA-based vaginal moisturizer is directly replacing a compound the body has just stopped synthesizing on its own.
You hit the nail on the head. It forms what the clinical literature actually calls a viscoelastic matrix on the vaginal epithelium.
Viscoelastic matrix, that sounds very sci-fi.
It does, but it basically just means a flexible, protective layer.
Right.
And this matrix reduces transepithelial water loss.
Which means it physically stops the existing water from evaporating out of the tissue.
Right, while supporting cellular turnover over time.
Now, looking at the sources, there's a really interesting multi-center randomized clinical trial with postmenopausal women, and they were using a hyaluronic acid vaginal gel.
Yeah, that study's a big deal.
It showed an 84.4% improvement rate in their vaginal dryness symptoms. But the part that really stood out to me was the comparison to the control group.
Yes, the results were not statistically different from the improvement seen in the control group, and that control group was using a prescription estriol cream.
Wow. So it performed just as well as the prescription hormone cream.
Exactly. I mean, multiple systematic reviews had concluded that HA has a profile of efficacy and tolerability that is highly comparable to vaginal estrogens for treating the symptoms of vaginal atrophy.
That is massive. For someone looking for an over-the-counter solution, it is literally a scientifically validated, hormone-free intervention.
It really is a game changer for a lot of people.
So what about the other compound, polycarbophyll? That seems to operate on a totally different mechanical principle.
It does, yeah. Polycarbophyll is a hydrophilic synthetic polymer. So instead of just holding water like HA, it works by creating a strong bioadhesive layer that physically binds to the vaginal mucin and epithelial cells.
Okay.
And because it adheres so tightly to the vaginal wall, it holds onto moisture and then slowly releases it into the underlying tissues over a period of, well, up to 3 days.
Oh, wow. So it alters the fluid dynamics of the tissue from the outside in.
Yes, exactly.
Now, when you look at the packaging for these products in the store, you want to look for formulations that pair these active ingredients with supportive elements, right? Because the sources point to formulations that pair HA or polycarbophyll with lactic acid to support the acidic pH, or like vitamin E for antioxidant tissue support,
Right.
rather than products relying on heavy perfumes or botanical extracts that just don't have clinical backing.
Yeah, you really want to avoid those perfumes. But consistency is the critical factor with either compound. Like, these moisturizers need to be used regularly to build up that hydration reservoir. The tissue plumping effect is definitely cumulative.
Okay, so that covers the baseline tissue health. But friction reduction during intimacy requires an entirely different mechanism, which brings us to the lubricant landscape.
The fun part.
Right. So water-based seems like the obvious, most versatile choice here. I mean, they are safe with latex condoms, safe with all sex toys, and they wash away easily. Why would anyone need anything else?
Well, because they are water-based, the water evaporates into the air or it gets absorbed by the tissues.
Oh, right.
So you lose the essential glide, which means you have to stop and reapply frequently.
Yeah.
And for someone dealing with severe atrophy, the friction created when a water-based lube suddenly dries out, I mean, it can cause micro tears in the delicate tissue.
Ouch. Yeah, that sounds terrible. So you upgrade to a silicone-based lubricant then. They're anhydrous, meaning they contain no water, so they never evaporate and they stay slick indefinitely. Plus, the silicone molecules are too large to be absorbed into the skin, making them highly hypoallergenic.
That's true.
But what about using silicone lube with silicone sex toys or, pelvic floor dilators used for therapy?
Yeah, that combination is an absolute chemical disaster.
It's not just losing the slip, right? It's like using nail polish remover on a plastic table.
Exactly like that. The silicone lube chemically melts and degrades the silicone of the toy. It ruins the surface, making it porous, totally impossible to clean, and capable of harboring bacteria.
So you ruin an expensive toy and give yourself an infection, great. But the pelvic floor therapy sources actually offer a really practical workaround for this, don't they?
They do, yeah. If you require the prolonged, thick moisture of a silicone lube for severe pain, but you also need to use a silicone pelvic wand for therapy, you simply place a non-latex condom, like a polyisoprene one, over the toy.
Oh, that's smart.
Yeah, it completely protects the toy's structural integrity while still allowing you to use the silicone lubricant on the outside.
Brilliant. Then there is the third category, oil-based lubricants. And we're talking natural plant oils here,
Yeah.
right? Like virgin coconut oil or specially formulated oil blends. They create an incredibly thick protective barrier on the skin that is highly moisturizing.
Yeah, oil-based lubricants are actually highly effective for external irritation or conditions like vulvodynia.
Okay.
But the fatal flaw here is their interaction with barrier contraception. Oil just utterly destroys latex on contact.
Oh, wow, on contact.
Yes, studies show that using mineral or vegetable oils with latex condoms causes a rapid reduction in burst time and drastically increases slippage and breakage rates.
So if latex condoms are part of the equation, oil-based lubes are strictly off-limits.
Absolutely off limits, yeah.
There is a technique mentioned in the clinical notes called the double glide trick, though, for those who are not using latex condoms.
I love the double glide trick.
Yeah. It says you apply a water-based lube on a toy or partner, and then an oil-based lube on your own body. And the two formulas interact to create this shear thinning barrier that mimics natural arousal fluid way better than either product does on its own.
It really does. It provides a deeply moisturizing, incredibly long-lasting glide. That practical application of combining categories is super useful.
Awesome.
But we really need to return to the invisible chemistry of these formulations, because choosing the correct category doesn't guarantee the product is actually safe for atrophied tissue.
Okay, let's go back to the water-based lubes then. Even if you correctly select a water-based product to protect a latex condom, the formulation itself might be working against you. This brings us back to that osmolality paradox we mentioned at the start.
Right, the osmolality. So osmolality is basically a measure of the concentration of dissolved particles in a liquid,
Okay, particles like what?
like salts, sugars, chemical additives. And nature always seeks equilibrium across a permeable membrane, which is exactly what the cells of the vaginal wall are.
So they let water pass through.
Yes. So if you place a liquid with a massive particle concentration against those cells, water will automatically move from the area of low concentration, the cells, to the area of high concentration, the lubricant.
To try and dilute it.
Exactly.
So if the lube is packed full of extra particles, sugars, and chemicals, it literally pulls the water out of your already dry, atrophied cells.
Yeah, you are actively causing cellular dehydration. You're causing the epithelial cells to shrink and potentially slough off prematurely just by using a highly concentrated lube.
That is horrifying.
It is. The World Health Organization guidelines actually recommend that personal lubricants stay under an osmolality of 1,200 milliosmoles per kilogram.
Okay, 1,200. And what's ideal?
Ideally, they should be closer to 380 to match the body's natural secretions.
Right.
Yet, analysis of popular commercial water-based lubes shows some household name brands clocking in at over 8,000.
8,000.
Yeah, over 8,000. It acts practically as a desiccant on vulnerable tissue.
A desiccant, like those little packets you find in shoeboxes to absorb moisture, that is exactly what you do not want.
Exactly.
The other invisible chemical metric to monitor is pH, because you explained earlier how the drop in estrogen starves the lactobacilli, which normally produce lactic acid. So a healthy vagina maintains an acidic pH between like 3.8 and 4.5 as a primary defense mechanism against opportunistic bacteria.
That's right. And when a lubricant's pH is highly alkaline, say, has a pH of 7 or 8, it neutralizes that natural acid mantle.
Which suppresses the remaining beneficial bacteria.
Yeah, and alters the microbiome environment completely. It significantly increases the risk of bacterial vaginosis and yeast infections. So matching the pH of the lubricant to the natural acidic pH of the vagina is vital for preventing compounding infections on top of the atrophy.
Now, there is one major physiological exception to that pH rule in the sources, right?
Yes, there is. Sperm. Sperm require a basic environment to survive and remain mobile, typically a pH between 7.2 and 8.5. A highly acidic, healthy vaginal lubricant will actually immobilize and damage sperm.
Oh, I see.
So listeners who are actively trying to conceive require a specialized fertility lubricant like Pre-Seed, which has an intentionally higher pH to support sperm motility.
That makes sense.
But for everyday comfort, tissue maintenance, and preventing atrophy symptoms, the requirement is an acidic isoosmotic formula.
Okay, armed with an understanding of osmolality and pH, we can really start filtering the products on the shelf. If I'm standing in the aisle looking at a lube that promises to, I don't know, soothe and desensitize pain with an active ingredient like benzocaine, that sounds exactly like what someone with GSM would want, right? Just dull the pain of the friction.
Oh, please do not do that. Masking pain during intimacy is incredibly dangerous.
Really? Why?
Because pain is a vital biological signal indicating that tissue is tearing, abrading, or being damaged. Numbing that nociceptive signal just removes your body's alarm system.
Oh, so you don't know you're getting hurt.
Exactly. It allows for excessive friction force, which leads to severe tissue injury and deeper micro tears, all because the physiological feedback loop has been silenced.
Wow, okay. Cross benzocaine off the list. What about the products that promise to feel warming or are marketed as like extra slippery for prolonged use?
So those tactile effects are usually driven by high concentrations of glycerin or propylene glycol.
Okay.
These are sugar alcohols used heavily by manufacturers to make water-based lubes feel thicker and stay wet longer.
And let me guess, they mess with the osmolality.
Big time. Because they require very high concentrations to achieve that warming or slippery effect, they drastically spike the osmolality,
Yep.
turning the product hyperosmotic and totally dehydrating the tissue.
Oh.
Furthermore, high concentrations of glycerin provide a carbon source that can actually feed yeast, significantly increasing the risk of developing thrush.
So if glycerin or propylene glycol appear on a label, what's the rule?
They should be at the very bottom of the ingredient list, making up less than 10% of the formula, or avoided entirely if you are prone to infections.
Good to know. And what about using simple household occlusives like petroleum jelly, like Vaseline?
No, using petroleum jelly intravaginally is strongly associated in the clinical data with a high risk of bacterial vaginosis.
Wait, really? Just normal Vaseline?
Yeah, it creates an impermeable barrier that traps heat, moisture, and bacteria against the tissue. It just disrupts the natural shedding and cleaning process of the vaginal canal. It is meant for external epidermal use, definitely not mucosal tissue.
Okay, the sources also flag antimicrobial agents like chlorhexidine or the spermicide nonoxynol 9,
Yeah, both of those chemicals act indiscriminately.
meaning they kill the good stuff too.
Exactly. They eradicate the protective lactobacilli right alongside any potential pathogens. It just decimates the local microbiome and leaves the tissue highly susceptible to irritation and secondary infections.
Yikes. So it is a total minefield out there. Now, there was one treatment modality in the clinical notes that initially seemed out of place in a discussion about topical treatments, and that was vibrators.
Yes. It seems counterintuitive if you associate vibration purely with recreation, but the medical guidelines actively recommend regular vaginal stimulation as a primary non-hormonal treatment modality for GSM.
And the mechanism is entirely vascular, right?
Yes. Regular stimulation increases blood flow to the pelvic region, bringing fresh oxygen and vital nutrients to the tissue.
So it's like a workout for the tissue.
Precisely. This neovascularization supports natural lubrication, improves tissue elasticity, and helps maintain the thickness of the epithelium. It acts as physical therapy for the pelvic floor, really operating on a use it or lose it principle for tissue health.
That is fascinating. So synthesizing all these clinical guidelines, the pelvic floor therapists essentially recommend building a comprehensive multi-part toolkit.
Yeah, exactly.
You need a daily moisturizer utilizing hyaluronic acid or polycarbophil to repair the tissue matrix and maintain baseline hydration. Then you need a low osmolality, pH-matched, water-based lubricant for versatile, safe use with toys and condoms. And finally, you need a high-quality silicone or oil-based lubricant for situations requiring heavy-duty, long-lasting friction reduction, provided you are carefully managing the material incompatibilities we discussed.
Yes, that is the perfect summary.
It really changes the entire approach to managing vaginal health. You aren't just looking for a single bottle to fix a complex physiological shift. You are curating a toolkit, what the sources affectionately call the no-shame lube drawer, based on strict chemical parameters.
I love that name.
Right. You are filtering out the high osmolality formulas that dehydrate cells, rejecting the alkaline pH levels that invite infection, and avoiding the numbing agents that mask tissue damage.
And considering how deeply the vaginal microbiome reacts to everything, I mean, from the specific sugar alcohols in a lubricant, to the molecular weight of a moisturizer, to the increased neovascularization from physical stimulation, we really have to stop viewing sexual health as a series of isolated, localized problems.
Yeah, it's all connected.
It is. The vaginal canal is a deeply interconnected ecosystem. And the products you introduce either support the structural integrity of that ecosystem or they actively degrade it.
Well said. You now have the exact scientific parameters to weed out the damaging formulas and find the highly effective, hormone-free interventions. You have the knowledge to rebuild and nurture your own ecosystem. Thanks for taking this deep dive with us. Take care of yourselves, and we'll see you next time.